Hello, everyone. My name is Sofia Hernandez, and today I will present a clinical case from the BMJ case reports titled Hypoglycemia due to interaction of glamipiride with isoniazid in a patient with type 2 diabetes mellitus. The patient was a 76-year-old woman who presented with episodes of cold sweating, palpitations, and lethargy. These symptoms appeared about 1 month after she started taking isoniazid as treatment for latent tuberculosis. She had a history of type 2 diabetes well controlled for 8 years with glamipiride, chronic obstructive pulmonary disease under home oxygen, and angina. Before starting isoniazid, she had never experienced severe hypoglycemia. After the new medication, she suddenly developed hypoglycemic episodes. Her blood glucose dropped to 1.4 millimoles per liter, with very high insulin and C-peptide levels, indicating hyperinsulinemia. She was treated with intravenous glucose, which initially corrected her levels, but another episode occurred the next day. Apart from her respiratory symptoms due to COPD, such as mild cough and shortness of breath, there was no new symptoms in other systems, no digestive, urinary, or neurological problems. Her medical background included type 2 diabetes mellitus, COPD with long term oxygen use, and stable angina. She did not drink alcohol and had never experienced any previous hypoglycemic crisis. She is retired and lived with her family, who provided excellent care at home. She did not smoke or drink, and there was no relevant family history of diabetics complication. On admission, her vital signs were stable, and no abnormal findings were detected. No on physical examination. Laboratory results show very low glucose, 1.4 millimoles per liter, elevated insulin and C-peptide levels, normal liver and kidney function tests. Imaging studies, including CT and MRI of the abdomen, were normal, ruling out any pancreatic lesions such as insulinoma. The final assessment was a hyperinsulinemic hypoglycemia caused by the interaction between glamipiride and isoniazid. Isoniazid acts as a cytochrome inhibitor, which increases the serum concentration of glamipiride. As a result, there was excessive insulin secretion from the pancreatic beta cells. Other potential causes, such as insulinoma or an autoimmune insulin syndrome, were excluded because both insulin and C peptide were elevated, indicating genuine overproduction of insulin. Isoniazid was immediately discontinued. Within 24 hours, her symptoms resolved and glucose levels returned to normal. 4 days later, glamipiride was restarted and no new hypoglycemia occurred. For tuberculosis management, she was prescribed with different medications for 6 months. During follow ups at 2, 4, and 6 months, her blood sugars remained stable without further episodes. To conclude, this case shows how drug interaction can have severe metabolic effects, especially in elderly diabetic patients. Clinicians should always evaluate possible interaction between oral anti-diabetic drugs and other medications such as isoniazid. Thank you for listening.